While COVID-19 cases are gradually declining, many are still suffering from the long-term effects of the virus. Associate Professor Dr. Anwar Suhaimi from University Malaya explains how to detect long COVID and what else to look out for.
We don't see much of cases going to the hospital because of the recent Omicron strain, but the data coming out from the UK shows that this strain that we're having right now is probably leaving you with a bit of a memoir of their presence or the visit to you. So there's actually a higher probability of getting long COVID from Omicron. Unfortunately, a lot of people confuse long COVID with post-acute COVID syndrome rather. So this is where definition is very important. And unfortunately, WHO is still sort of going around how to define it. So we will stick to what WHO has already said. Number one, these symptoms must have occurred after a confirmed SARS-CoV-2 infection. The symptoms usually occur at 3 months onwards, and it lasts for about 2 months. But if I, as a medical practitioner, is about to wait for 3 months before I do anything, unfortunately, the functional deficits might have set in, and this is when rehab probably won't exert its best effect. So for that reason, we step in at 4 weeks once we've identified the symptoms.
Dr. Anwar explains how long COVID can affect us.
We have identified 5 main domains that will be affected or can be affected more commonly because of long COVID. So there are difficulty in breathing or shortness of breath, fatigue, which I mentioned earlier on, can be physical or mental fatigue. Sometimes there will be individuals who have affected speech, like hoarseness of voice, a lot of coughing, or even to the extreme of swallowing difficulty, which will affect nutrition. More commonly is the brain fog, whereby there may be difficulties in attention, in recall, in memory, and also in thinking speed. And some people find that this is very challenging when they go back to work. And if the nature of your job is very, a lot of cognitive, a lot of thinking, a lot of decision making, so they find they're a bit slow, and this stresses them, which leads to the 5th domain, which is anxiety, depression, and insomnia.
Dr. Anwar also talks about the importance of rehabilitation for those suffering from long COVID. He also suggests for patients to be vigilant and monitor for symptoms before it's too late.
So how does rehab tackle all this? Essentially, we need to identify, or we need to understand the source or the reason why we develop the symptoms. So for example, shortness of breath can be from the acute lung changes. And this is very prominent during the Delta wave, but during the Omicron, we don't see a lot of very sinister lung changes. But so then why do I still get shortness of breath? This can be due to what we call post-exertional malaise. So something like when we had a viral infection, you have this period where you just feel a little under the weather. But we do know that COVID is not just another flu. You can have changes, inflammatory changes, that we are still trying to understand the pathophysiology of how the virus affects multiple organs in the body, including the nervous system and the heart, is still being investigated. But a lot of people think it's just a medical condition, but I'm telling you, sometimes the price you pay is more than just your, it's not just health, it's your quality of life. It can even be your mental health and your occupation, So the full effect, I don't think COVID is going to leave us. When I say that, I'm not saying the disease, I'm talking about the impact. Will not leave us anytime soon. You probably will be seeing this for a couple more years. So we have to try and mitigate as much as we can. I really don't know how bad is this long COVID going to go, but we know it's going to be here for a while, and the impact is going to be around. So the faster we get this information out to people, the more that you can do for yourself before you step in.